My name is Dr. Ken Alleyne, a sports medicine and joint reconstruction surgeon. And we have a series of videos that we're going to discuss some of the more common things that we see here in my orthopedic surgery and sports medicine practice. By way of background, I am a board-certified orthopedic surgeon. My training has occurred at many places around the country, including Williams College, Medical School at Wake Forest University, Howard University Hospital for residency, Yale University for my sports medicine fellowship, and then a research fellowship at Harvard MIT in Cambridge. The majority of my practice are problems of the knee and shoulder, and our practice here at Eastern Orthopedics and Sports Medicine ranges from school-age kids to active seniors, professional athletes, collegiate athletes, and Olympic athletes. So we have a pretty diverse practice. What we'd like to do today is discuss a series of the more common things that we see in hopes that it will help to direct our patients in their care to ask the appropriate questions of their doctor and to make sure that they have good information in regards to their orthopedic concerns. Adhesive capsulitis or frozen shoulder is a very common problem seen in the orthopedic surgeon's office. Often with no particular inciting event, at least many patients don't recall an inciting event, adhesive capsulitis or frozen shoulder is a stiffening or inflammation in the ligaments of the shoulder that can be quite painful and cause you to lose significant motion in the shoulder. The shoulder, in addition to the many muscles and tendons that surround the joint, is also surrounded by ligaments. And you can think of these ligaments as elastic bands in a way. Another way to think of them as a saran wrap or a shrink wrap of the shoulder. Well, if that shrink wrap gets tight or those elastic bands lose their elasticity, the resulting problem can be severe pain and stiffness and decrease in motion in the shoulder. We do know that it has a high correlation with patients who have diabetes, thyroid problems, and other medical problems. But sometimes it's a very, very incidental finding in a patient who is just carrying out their normal activities of daily living. Some of the things that I've seen in my practice that we believe may have been associated would be an injury to the shoulder, removing something from the overhead bin on an airliner, taking groceries out of a car. And I even had one mom who turned around to smack her 3-year-old who actually injured her shoulder and came subsequently with a frozen shoulder. Now, the vast majority of frozen shoulders are treated conservatively. By that I mean the vast majority of frozen shoulder does not require operative intervention. It does require patience on behalf of the patient as well as the physician. In addition, anti-inflammatory medications such as steroids, Advil, Motrin, and other non-steroidal anti-inflammatory medications, and a prolonged program of home therapy and formal physical therapy may be required to, quote, thaw a frozen shoulder. We tend to measure progress in frozen shoulders in weeks, certainly not days, and sometimes months, with some patients taking up to 6 months or longer to resolve a frozen shoulder. In our practice, I would say the average is about 3 to 4 months for a frozen shoulder to be relieved. In that time frame, in addition to medications, we may also decide to place an injection inside the shoulder of a steroid to try to ease some of the inflammation and to help the shoulder along in terms of its motion. Occasionally, for patients who simply aren't making much progress, we will also offer what's called a manipulation under anesthesia. With this procedure, we go to the hospital and a patient is put to sleep with an anesthesiologist, often also with a block of the nerves in the shoulder or at the neck that numb up the shoulder to allow us to move the shoulder and release the scar tissue inside. It's a pretty profound procedure where you can actually hear the popping and cracking of those ligaments as they release or the contracture in them lets go. We immediately return those patients to physical therapy in an attempt to keep the motion that they've gained. Almost routinely, most frozen shoulders resolve with a combination of what we just mentioned. In a small percentage, that still doesn't work, and we do have to carry out arthroscopic surgery. By arthroscopic surgery, we mean generally a few very small, 2 to 3 half-inch incisions around the shoulder, filling the joint with water, and going in with small instruments and releasing those ligaments, i.e. loosening those ligaments up such that the shoulder can regain motion. You go home the same day. The procedure itself may be 20 to 25 minutes long, and you immediately will begin with physical therapy, both on your own and with a formal physical therapist in most cases. Again, this is what we do in our practice. What your own surgeon may do may vary. Generally, patients get 100% resolution of the symptoms with some combination of what we've just discussed. For further questions about frozen shoulder, please don't hesitate to visit us at www.eosm.net.